Now, President Muhammadu Buhari has bemoaned the danger of illicit drugs amidst criminal activities being perpetrated across the country. According to him, the danger posed by these substances is worse than the impact of insurgency and banditry that Nigeria currently contends with. The president stated this on Saturday during the launch of War Against Drug Abuse, an initiative of the National Drug Law Enforcement Agency to commemorate the United Nations International Day Against Drug Abuse and Illicit Drug Trafficking. President Buhari, who was represented at the event by Boss Mustafa, Secretary to the Government of the Federation, said that he had seen 3 generations, grandparents, parents and children, destroyed by illicit drugs. He added that the war against drug abuse is beyond the slogan, but a call for civil action for all Nigerians to take active part in this war. And joining us now on the morning show to discuss this salient subject is Dr. Nseabasi Emmanuel Ekanem, a public health consultant and CEO, Trinity Healthcare Foundation, Nigeria. Good to have you join us on the program, Dr. Nseabasi.
Thank you for having me.
Okay, so let's start with your reaction to what the president says with regards to substances being more dangerous than insurgency and banditry.
Okay, well, what the president said is absolutely correct. As a matter of fact, I would want to reiterate that the dangers of illicit drug use in this country is so devastating. I mean, we've seen lots of reports. I mean, I think about 2 years ago, BBC covered a report on the use of codeine-containing drugs, and you could see the terrible effect that it had on young people. I mean, if you go to some of these, the hideouts where some of these bandits are, some of the kidnappers, and even the terrorists, you see that the main substance, that helps them, to carry out the actions they do, the nefarious activity is drugs. I mean, cocaine, marijuana, heroin, and all of that. These are some of the substances that these bandits, these terrorists, use, to elicit that effect that helps them to carry out dastardly acts without any form of remorse. So honestly, the use of illicit drugs in this country has brought us so much, issues, so much problems. If you pay a visit to our psychiatric hospitals, I'm telling you, you're going to see lots of young Nigerians, promising Nigerians that are there incarcerated because of, illicit drug use. Honestly, the dangers of drug use, illicit drug use, is so much from the health angle, from the social angle, psychological, religious, and otherwise, even from the economic angle. So the president could not be any further right in terms of what he said, that the dangers of illicit drugs is far more than, what we are seeing, the banditry and all of that. And because of this, it is absolutely necessary that we tackle it holistically, bringing all the stakeholders on board to ensure that we end illicit drug use in this country.
All right, well, we do have to bring all the stakeholders. And like the president has mentioned as well, terrorists and bandits use these illicit drugs to enhance their activities. Well, like you just mentioned, drugs like codeine, which was banned since 2018, according to NDLEA, is still circulating. Now, what would you say the role of the Pharmacists Council of Nigeria will be in combating the circulation of codeine? As you know, that there are about 20 pharmaceutical companies that produce codeine in Nigeria at this point.
Well, let me put it very clearly and let me put it in context. The Pharmacists Council of Nigeria is doing its best. But you see, when you have a country where we have open markets, open drug markets, we have 3 of them. We have one in Kano, we have one in Lagos, Idomata, we have one in Onitsha. And the Pharmacists Council of Nigeria, I can tell you on good authority, has been making efforts over the years to see how these drugs market can be regulated. They have designed a lot of framework which has been, put forward. And unfortunately, I will tell you that this country, we actually lack the political will to do that. Severally, you see conferences, seminars with good policies, to regulate the drug market, to ensure that we reduce the chaotic nature of drug distribution in this country. Unfortunately, once it gets to where it's supposed to be signed, it's supposed to be implemented, I tell you, that is where it ends. So the main problem we have is not the Pharmacists Council. It is the proliferation of open markets, and it needs the political will of the executives in this country to make sure these places are closed down or at least better regulated. I will tell you this. Pharmacists community pharmacists in this country are well regulated by, the Pharmacists Council of Nigeria. You can there's no pharmacy in this country that you go and request for these controlled substances. They will tell you that you must either append your name on the poison book so that it is on record that you requested for this, and it can only be sold with a prescription. But when you go to the open market, if you go to Domata now, you can even buy substances containing codeine, a lot, morphine, hydromorphine, and all of that in the open market. So until we are able to control the open market, until we're able to regulate distribution of drugs in this country, which lies under the purview of the Federal Ministry of Health, then it will be probably very difficult for us to control the proliferation of illicit drug in this country.
Now, I know you've talked about these drugs quite a bit, but and we're still on the subject of the Pharmacists Council of Nigeria. I wanted to gauge your thoughts regarding what government agencies should be doing, really, and not just the Pharmacists Council of Nigeria, but the NDLEA, as mentioned by my colleague Oji, and NAFDAC as well, and like you mentioned, the Ministry of Health. What should all of these agencies be doing to sort of mitigate the use of drugs in the country?
Yes. So, like you've rightly mentioned, there are agencies that are saddled with the responsibility of regulating the use of drugs in this country, particularly the National Agency for Food and Drug Administration and Control, NAFDAC. It's the duty of NAFDAC to ensure that drugs are safe and they are used within the regulatory framework in the country. And several times I would say this because at some point I worked with NAFDAC, and I can say categorically that NAFDAC, through the enforcement unit, has been doing quite a lot to regulate the use of drugs, the distribution of drugs in the country. The Food and Drug Directorate in the Federal Ministry of Health has also been doing a lot. The NDLEA has been trying, but we need a more concerted effort. We need a more pragmatic effort in this regard. And we need a multi-sectoral, collaboration to ensure that illicit drug use and distribution in Nigeria is tackled headlong. Sometimes you see some of these drug traffickers, drug barons. Some of these people, I want to say categorically, some of them are untouchable. Over the years, we have seen a lot of difference within the past 5 months. With the new chairman of the NDLEA. But before now, we've seen some of these people would traffic this drug and will get away with it, I must say. So I think there is need for us we have all the laws. The National Drug Policy of this country of 2005 stated this categorically, stated all the regulation regarding the distribution and use of drugs in this country, particularly the controlled drugs. We need to make sure that these policies are implemented to the letter. I want to say that some of the regulatory agencies are understaffed. I must say that categorically, because for us to control this drug, we need people, foot soldiers, to be on the ground, to monitor these premises where people are merchandising illicit drugs. We need to cut the supply chain of these drugs, so that people will not have access to this drug. Because one of the problems that we have in this country is that due to the chaotic nature of drug distribution, people can have access to all kinds of drugs, all manner of drugs, with or without prescription. And this is what must stop. So we need to empower the regulatory agencies. We need to ensure that they put their foot on the ground and tackles these drug peddlers or these drug traffickers, and ensure that these people are brought to book. And again, I want to say that the penalty for drug trafficking in this country, as at 1984, I will tell you that the penalty, it was a capital offense. But now, because of outcry here and there, it has been reduced. And because it has been reduced, a lot of people are going into drug trafficking. In countries like Singapore, if you are caught with illicit drug, it is a death penalty. I think we need to bring out more stiff penalty so that people will, it will serve as a deterrent to people who are involved in drug trafficking. So both the executive, both the agencies, ministries and departments of government must make sure that we put our foot on ground, face these people, and anyone that is found culpable must be prosecuted, and stiff penalties must be meted to these people.
Now, what would you recommend as a stiff penalty? The death sentence?
I want to say this. Given the impact of drugs, I mean, if you go to some of these psychiatric hospitals, you see that people who have taken drugs, I mean, they have the altered mental capacity. Now, somebody who has taken illicit drug can even kill. So a person that takes drugs can be termed as a potential murderer. Now, if a person that takes drugs is a potential murderer, the person that supplied this drug to the person is an accomplice in murder. So I feel that maybe not a death sentence, but stiffer punishment, long terms imprisonment must be meted as a deterrent for others who are going into this business on a daily basis. Because now Nigerians, I must tell you that Nigerians are seeing drug peddling as a very good business opportunity that is bringing a lot of returns. We need to ensure that these people are discouraged as much as possible. Apart from seizing the money that they make from these products, we need to ensure that they save long terms imprisonment as a result of their actions.
Well, let's speak on statistics here. You know, the Nigerian Bureau of Statistics estimates that nearly 15% of the adult population in Nigeria, that is about 14.3 million people, reported a considerable level of use of psychoactive drug substance. In the face of economic hardship, the illicit drug industry is still on the rise, as you all know. No, we all know. We don't know the contributing factors at this point, which we might try to point out in the later part of this interview. The report also shows that the highest level of drug use was recorded among people aged 25 and 39, with cannabis being the most widely used drug. We're seeing that our young population, this has become almost like an epidemic. As in the case of that 21-year-old Chidinma who confessed to killing a television executive because she was high on drugs. Actually, I think it was Rufus that she had said that they had taken at that point. Now, how do we address all of this in the face of, even this economic hardship that we are facing? How are these young people getting their hands on these drugs?
Well, I would say that, like you rightly said, we need to identify the risk factors. We need to identify those conditions that are pushing these young people into drug use, one of which is redundancy. So you see a young population. Nigeria is actually a very young population. And when you learn that over 33% of the population is out of job, I mean, then you wonder what is going on. Now, with these people out of jobs, I mean, it is a popular parlance that an idle man is a devil's workshop. And so you see these people indulging in drugs because they have nothing else to do. You rarely see a man who is focused in his job, who is doing something profitably, going into drugs. It's almost very difficult to see that. And again, we need to address societal ills. You see, musicians, I'm sorry I need to mention some names. Musicians like Olamide, like, this Naira Marley. You see these people smoking publicly in music videos. And these are the same videos that have not been censored, but have been put in the public. Young people are watching these videos and they see these, musicians as, models, as stars. What do you expect them to do? They see these people being celebrated. You see people, this same musician being made, brand ambassadors. What do you think young people will do when they see that people who are abusing drugs are making it? They are being celebrated. Honestly, your guess is as good as mine. So one way we can do that is to make sure that people who are even found, some of these music artists that are found, abusing drugs, using illicit drugs in their music videos, they need to be prosecuted. We need to make sure that even in school, and I remember in the days, we used to have anti-drug abuse clubs in our secondary school, even in our universities. But over the years, over the decade, I've seen that these things are fizzling away. We need to, reinvent these initiatives. We need to engage the traditional rulers. Now, if you go to some places, you see young people in street corners involved in illicit drug use. These people belong to communities. We need to engage them. We need to make sure that we influence their behavior, cause a behavioral change by bringing people whom they listen to, community leaders, religious leaders. These people can speak to them in the language they understand and can help them, to break away from these particular activity. Again, we need to have what we call more rehabilitation centers. A lot of people that are on drugs, I will tell you this on good authority, a lot of them want to probably stop it, but they cannot, because you don't just stop drugs. No, you don't. There has to be a gradual process. You have to be put through a therapy to help you to withdraw successfully from some of these substances. We need more of these centers that are equipped with personnel and facilities, to ensure that people who have been addicted to substances can be withdrawn from these substances successfully. And at the end of the day, you see that more of these people who are willing to break away from this attitude of this habit will be able to break away from it. So there are a lot of solutions to tackling this problem, but we need to ensure that whatever we are doing is result oriented, and we need to ensure that everyone is carried along, both the parents, both the teachers, the community leaders, religious leaders. Everybody must understand the need, for a drug-free Nigeria. And we must make a concerted effort to ensure that the young people who are the major culprits in this illicit drug use are being groomed in the proper way. Parents have a very important role, because you see, some parents don't. Parenting is a very serious responsibility, and parents must learn to understand that whatever a young person becomes in the future depends on what sort of training that person was given at the point of infancy or at the point of growth. So parents play a very important role, and these parents must ensure that their children, their wards, are kept away from drugs, and they are kept away from videos, adverts that promote illicit drug use.
Right. So as we have this conversation, I've heard you mention young people over and over and over again. So it seems like drug use and illicit use of drugs or drug abuse are sort of synonymous with youths and young people in particular. But do you think that there are exceptions to this? And can you give specific instances? And also, we've been talking about drug use for a bit of time. I'd like for you to give us specific examples of what those drugs are. Because when we talk about drugs, some people just immediately think codeine, morphine, morphine, like you mentioned earlier on, cannabis, and that's it. That's where they draw the line. But perhaps you in the industry, you might be able to sort of provide us with more that we should watch out for and things that we should take heed of as well.
Okay, basically, let me start with the last question. Just for the sake of clarity, so that people understand what we're talking about here. Illicit drugs are basically those drugs that are called the psychoactive drugs. These are drugs that would alter mental, state of a person. When a person takes these illicit drugs, I'm going to list them, it alters that person's mental orientation, and the person begins to act abnormally, and the person can do just anything from, committing suicide, to killing, to doing every kind of nefarious act. Now, some of those drugs include, we have morphine, we have codeine, we have marijuana, we have, we have heroin, we have tramadol. Tramadol has been used recently by young people because of the belief that it helps them to, to last long when they're having sexual activities. This is one of the, you see young people purchasing tramadol of up to 220 milligrams. This is a very high dose tramadol that can cause, of course, that will definitely cause, addiction. So these are some of the drugs, we have, cannabis. The reason why we stress cannabis is that cannabis is the most popular one. And I will tell you something. In some part of this country, cannabis plant is planted in plantation. People see this plantation and nothing is done about it. Traditional rulers failed to report about the existence of these, plantation. In some places in this country, cannabis leaf is used in preparing soup. There's a report recently that made the round in social media where a lady, a young girl, was making, cake, yes, with cannabis. These things have to be identified. These are some of the drugs of addiction. Most people feel that, sometimes you see people going to buy cough syrup containing codeine. It is not because they have cough. It is because they want to have that euphoria that comes with taking high dose of codeine. There was a time where I visited a pharmacy. I saw somebody going to buy, he said, I want 10 bottles of codeine. The pharmacist said, no, I can't give it to you. Let me see your prescription. He couldn't offer the prescription, and so it was sent away. So you see people taking almost 10 bottles of codeine containing cough syrup. It is not because they have cough. It is because they need that effect that codeine gives. You see a lot of illicit use of these drugs without a doctor's or a clinician's advice. These are some of the drugs that is abused daily in this country as a result of this addiction. And then I don't quite remember your first question, but okay, you talked about young people. Now the truth is that there's what we call curiosity. One of the factors that predisposes people to using drugs is curiosity. Young people are very curious. They want to know the next thing. They want to know what's up about this drug. People have been taking this drug. You see young people gathering together. I know a lot of persons that actually got addicted to tobacco because they were in they were in peers of people that are smoking. So they were encouraged to smoke. And that is where peer pressure comes in. And this is common among young people. So one of the ways we need to tackle this is to make sure that we have peer groups, peer educators that will discourage the use of drugs, even tobacco. Alcohol is also a substance of abuse. These substances, we need to make sure that they are properly controlled. The use of these substances are controlled. And that is where the media comes in. The media needs to make advertisement, enlightenment, to tell people about the dangers of taking these drugs. So that while they see videos of people, musicians that are taking drugs and are being celebrated, then at the same time, the media should make sure that these people, messages discouraging people from taking this is, well pronounced. For example, in tobacco, you see written there on the tobacco product that smokers are liable to die young. We need to see more of this. We need to see more of this, enlightenment, so that people will know that taking, cannabis or any other substance of abuse will lead to a very devastating effect. We know some people that have died because of the use of illicit drugs. We had Marvin Gaye, we had Brenda Fashe, we have even this Magic Fashe in Nigeria. So we have people that we know that they have been using these drugs and they have died as a result. I don't want to probably go through the clinical, the devastating effect, of the use of these substances. But we've seen people that had liver failure, kidney failure, lung cancer, and many other, clinical conditions as a result of the use of illicit drugs. What about pregnant women that take these drugs? They end up either killing their unborn baby or giving birth to baby with serious mental retardation. So in all of this, cannabis and other illicit drugs have devastating effects, and we need to make sure that we keep emphasizing this so that people will learn and understand that the use of this substance should be discouraged as much as possible.
Well, just to clarify again, did you say tobacco and alcohol are considered illicit drugs?
Tobacco, these are drugs. Let me tell you this. We categorize this drug as drug of addiction. Now, the most important thing here is addiction. When people take tobacco, because of the nicotine in there, you see that they develop addiction from 1 stick to 2 sticks to 3. Before you know what, they're taking packs.
I'm asking this because you have hinted these musicians, you mentioned Naira Marley using these illicit drugs in their music videos. Yes. I don't know how you can, assert that it is illicit drugs, but now you're saying it's tobacco because we do see him smoke in the music videos.
Exactly.
And all of that. So you are convinced that tobacco is an illicit drug?
It's actually an illicit drug. Yes, it's an illicit drug. Because when it is used, it will definitely alter the mental state of the person that is taking it. Even alcohol is a drug of addiction. You know, people feel that alcohol is an in thing, is a normal thing. But I tell you that high intake of alcohol, of course we know, causes drunkenness, causes mental retardation. So these drugs are substance of abuse, and of course, by virtue of that, they are illicit drugs and should be avoided as much as possible.
All right, so for anyone who is watching and is, has in one way or another gotten themselves involved in abusing drugs, what would you say for them to do in order to desist and to sort of stop from getting themselves engaged in further abuse of the drugs? What would you say are the do's and don'ts that they should engage in? Okay,
first of all, if somebody, if a viewer of this program, or you get to learn about this or know about drugs and the need to avoid drug abuse, I would tell you this: there is, for every kind of drug of abuse, there is a withdrawal therapy. I mean, your clinician, your doctor, basically there are psychiatric hospitals that are trained, that have trained professional experts that can help you withdraw successfully from this substance. There is no substance on earth, I would say this categorically, that cannot be withdrawn from. But you need that guide. And that is why we have rehabilitation center. So speak up to somebody, tell your healthcare provider that you want to withdraw from these substances. And then again, while you are withdrawing from it, as much as possible, try to ensure that you keep yourself away from these companies. Those companies that always, peers that always, indulge in these substances. Because the truth is this: there's what we call reinforcement effects. If you are on a withdrawal therapy and then you are still in company with people that are smoking, people that are taking, this illicit drug, at the end of the day, I can assure you that you may end up falling back to it. And then again, I want to say that if you also want to, to withdraw, also ensure that you get the right support. There are support organizations that will provide support and that will help encourage you so that you can see the need and also have the courage to withdraw from these substances. Because for us to withdraw from substances, we need the right kind of therapy. It is possible, it is easy. And I will say this as my final word, that Nigeria can be free of drugs. Yes, it is possible, but it needs you and I. It needs everybody to understand the debilitating effect of drugs and make conscious effort to withdraw from these substances, because drugs, illicit drugs, does not provide any benefit whatsoever. If you thought of any benefit that it gives, it doesn't.
Well,
the only thing it gives is a devastating effect at the end of the day.
Well, thank you so much for your input on this interview. Very well said.